Hello, my name is Julian Hernandez. I'm studying medicine, and today I'm going to talk about two topics: the different medical specialties and cardiology, that is my favorite one. First, we have to know that the human body is a very extensive area of science. Because of this, medicine is divided in different specialties, and also it explains why it's necessary the work of many persons for the treatment of only one patient. There are a lot of specialties, but they can be divided in three groups: internal medicine, surgery, and others. The first type, internal medicine, is related to the diagnosis of disease by studying their signs or symptoms. Also, they use different tests to confirm their diagnosis. It has to be studied during 3 years after finishing medical school. After studying internal medicine, you have the possibility of choose another specialty like neurology, cardiology, gastroenterology, nephrology, and others. The second type, surgery, its function is to invasive procedures like removing something pathological, for example, a tumor, or change the anatomy, such as rhinoplasty. It has to be studied during 4 years, and after that they can study other specialty in a specific area like cardiovascular surgery, gastroenterology surgery, and others. The third type, others, refers to those specialties that are not related to the previous one. In this group, we can find dermatology, neurosurgery, radiology, and others. In conclusion, medicine has many specialties, and each one of them is important to give to the patient an integral treatment that can be the best for them. Now I'm going to talk about cardiology, that is my favorite one. So what is cardiology? Cardiology is a branch of medicine dealing with disorders of the heart as well as part of the circulatory system. And what is a cardiologist? A cardiologist is a doctor with more than 15 years of experience. He's an expert in clinical research. He's a doctor who can do some invasive procedures despite not being a surgeon, like a catheterization. He's someone who rehabilitates patients and prolongs their life. What disease do they treat? They treat congenital disease, that are those diseases that are found in newly born, for example, aortic coarctation, persistent truncus arterius, and others. We have also this ischemic disease, that are those diseases in which we found a decrease of oxygen in the heart. For example, acute myocardial infarction or angina. We also have the pericardial disease. We have to know that the pericardium is a membrane that surrounds the heart. So we can find the pericarditis, the pericardial effusion, and the cardiac tamponade. We have the electrical conduction disease, that are those diseases in which we found a change in the normal reading of the heart. What tests do they use? Cardiologists use different tests that allow them to know the state of the cardiac muscle, electrical conduction system, different cardiac and vascular variables, and a lot of information that allows diagnose and define the best treatment for each patient. We have, for example, the electrocardiogram, that is a test that shows how is the electrical conduction and the shape of the heart. We have the echocardiogram, that is a moving image that allows you to see the heart in real time. We have the Holter monitor, that is like a long electrocardiogram because the patient have to use it for 24 hours. The stress test, in which you have to run or use some exercise, and it allows you to know about the state of your coronary arteries, that are the arteries located in the heart. Cardiology have some specialization that a subspecialty is the highest level of education in medicine. So we have the electrophysiology, the interventional cardiology, the nuclear cardiology, cardiac rehabilitation, and the echocardiography. Finally, I'm going to talk about the cardiology in Colombia. So cardiology, it is possible to study in many universities of Colombia. Some of them are Javeriana, Rosario, Andes, UNAP, Universidad del Norte, Universidad del Valle. Also, in private university, the price is between 7 and 15 million pesos. It has an estimated duration of 2 years. In its curriculum, there are subjects like cardiology, investigation, electrophysiology, hemodynamics, pediatric cardiology, and others. There is an association called Sociedad Colombiana de Cardiología y Cirugía Cardiovascular that is in charge of publishing the new studies in these specific areas. So that was all. I hope that this information be useful for you. Bye.